I'm John Collins with Parkinson Society Central and Northern Ontario, and I thank you for joining us here tonight. We try to run these webinar sessions once every 2 months or so, if not a little more frequently, and this is our second one this year, and I'm pleased to be here with Julie Wysocki, who is our Director of the National Research Program. I'm going to turn it over to Julie really briefly to give a session on our program, its merits, how it works, and also some of the research programs that we're presently funding. A few housekeeping rules before we begin. Again, hopefully you'll be able to hear me at this juncture. You should have your speaker volume to a comfortable level on your system. The only voice you will hear is Julie's tonight and occasionally mine. If you do have any questions or technical concerns, you can type them into the chat box on the lower right-hand corner of your screen. Most likely, Julie will wait till the end of the presentation to address those, and I will bring them forward to her. But don't stop yourself from typing out a question if you have it, so that we can have it recorded, and we'll address it with her at the end of the session. Otherwise, I think everything should be pretty straightforward this evening. I should mention that the session is being archived. So, speaking of your chat comments, you'll be recording them. They'll be recorded and visible for everyone to see. So, just keep that in mind if there's anything you'd be concerned about sharing. Otherwise, I thank Julie for being here, and I will turn it over to her to deliver her presentation this evening. Thank you.
Yeah, thank you, John. As John mentioned, my name is Julie Wysocki, and I'm the Director of the National Research Program here at Parkinson Society Canada. And our National Research Program is really a true collaboration of all the Parkinson societies across the country. So tonight I'm going to just talk to you about the program and how it works and what we're funding and so forth. Just give you a broad overview. So as I mentioned, it's a collaboration of all the societies across the country. And what kind of research do we fund? So we fund investigator-driven research, and what that is instead of us saying we want research done on this particular thing, which that would be classified as strategic, we let the researchers come up with questions that are creative and outside the box, so that we can fund novel research that may lead to breakthroughs. And when we talk about discovery research and exploratory, that's also known as basic science. So basic science research, that's really the beginning of research. That's a research that's done in the lab. You know, when you think about test tubes or mice and that kind of thing, that's the kind of research that we're talking about. And that's really the beginning of our research, and eventually this is research that will lead to treatment or clinical research later on that leads to humans. And when you talk about psychosocial and quality of life research, this is the kind of research that gives us insight into the experience of people living with Parkinson's, caregivers, anyone affected by Parkinson's. So this kind of research gives us insight into that, and the information that we gain from this can be used to either improve treatments, support services, or plan advocacy strategies that can influence policy decisions, that can influence healthcare systems, such as waiting time to see a specialist and that kind of thing. And clinical fellowships are about physicians, specifically neurologists, to learn new techniques to treat people with Parkinson's or other movement disorders. So this is really addressing the need and the shortage of leaders involved in treating people with Parkinson's. So this is a nice diagram to just kind of really show you where our research fits in the research pipeline. So the green circle in the left-hand corner, that's basic research. As I said, basic science that's done in the lab. And about 75% of our funding goes to this research. And then there's clinical research. This is research done in the clinic. So sometimes when you go to the doctor and they want you to, they ask you if you want to be part of a study, and so they keep track of your progress and so forth. That's normally part of clinical research. And our psychosocial research, that makes it about 25% of our research budget. And all these kinds of research can lead to treatments, and to new treatments, therapy, education material, health services policy, and so forth. And the one type of research that we do not fund is translational research, and that's I'll just give you an idea what that is. That's the research that's done towards getting drugs, clinical trials, getting drugs tested with people, and that's the kind of research that that's the Michael J. Fox Foundation does. So we are really complementary to each other. If you're wondering where we stand in regard in comparison to them. So without the basic research done at the beginning of the research process, there wouldn't be translation research to do later to try to actually come up with drugs. So our funding philosophy. So we invest in Canadian Parkinson's research, and by maximizing funding. So that means we try to fund as many people as possible so that we can have more ideas being generated, rather than funding huge projects and just fund a few. And building capacity, we fund studentships and people at the beginning of their career, so that in the future there will always be Parkinson's researchers in the pipeline coming up to replace any researchers retiring. And we support innovative research. So this is again where it goes back to the investigator driven, because this is where breakthroughs come in, where you allow people to investigate, do curiosity driven investigation. That's where breakthroughs will come through, instead of us dictating what they should be doing. So we've been funding research for about 31 years, and we have funded over 21 million in over 400 awards. And last year alone, our 2012, we funded 48 research projects at a total of about 2,300,000. And this is just a snapshot of last year's funding, where the percentages of where our funding fell. So that gives you an idea. As you can see, the causes of Parkinson's up here, the 43%. That's a lot of basic science. So how do we support research? So we hold competitions, 2 competitions per year, and our awards range from 30,000 to 100,000. That's going from studentships to the pilot grants, the research grants. And all the applications are reviewed by a arm's length panel made up of experts from across the country. And the chair of this body, the Scientific Advisory Board, is Dr. Edward Thon from McGill University. And because it is such a small community, the Parkinson's research community, they review the applications, but they don't make funding recommendations. Then the information goes to another committee, the Research Policy Committee, which is chaired by Dr. Pierre Blanchet from Quebec as well. And this committee is a subcommittee of the Parkinson Society National Board of Directors. They make the funding recommendations, and the recommendation then go to the board, and the board approves the recommendations. Sorry about the empty slides. So what we're currently funding, the breakdown is causes for Parkinson's, complications of Parkinson's, biomarkers, neuroprotection, cognitive impairment and Parkinson's, improving quality of life for people with Parkinson's, and clinical fellowships. I'll go through each one again in detail. So in terms of causes for Parkinson's, so the reason we fund this is, as you know, Parkinson's is very complex. There's underlying reasons for the cause of Parkinson's. There's genetic or environmental dispositions, and we're finding this so that by trying to figure out what gene causes the disease, maybe drugs can be developed to actually either prevent the disease or at least slow its progression. So one of the people we're finding under this category is Dr. Mark Ecker from the University of Ottawa, who is studying zebrafish. And the thing with zebrafish is they regenerate new brain cells. And the process in which they do it is quite similar to humans, except humans don't regenerate brain cells. So what he's doing is trying to study the zebrafish, how the process they use to regenerate brain cells, and maybe this will lead to some kind of stem cell therapy for people with Parkinson's to regenerate dying brain cells. And so the next category is complications of Parkinson's. So part one of the complications of Parkinson's is cognitive fatigue. This is not fatigue caused by any exertion. It's quite debilitating. And so Dr. Cho, who's at University of Toronto, is studying brain scans of patients that have PD, that have the cognitive fatigue, and those that don't. And with the hope that analyzing the results could hopefully lead to new therapies to treat cognitive fatigue. And biomarkers. So biomarkers are important because they can help scientists predict and maybe diagnose and monitor PD early on. So they may help in detecting the disease really early, so that treatments can be tailored and start sooner. So they can be used to identify individuals at risk of developing the disease, improving diagnosis, and even measuring disease progression. So Dr. Anthony Lang is at the University of Toronto, and he is investigating biopsy as a diagnostic test for PD. And this study was prompted by an earlier study in the US that found that very early in PD, nerves in the bowel will demonstrate the presence of a protein called alpha-synuclein, which is known to contribute to PD progression. So Dr. Lang is trying to replicate this study with a larger patient sample in the hopes that it will permit an early accurate diagnosis of PD in the early stages and be used to measure disease progression, disease-modifying therapies in the future. And neuroprotection, we're finding that some naturally occurring substances have been shown to protect the brain from degeneration. And some of those are omega-3 fatty acids, caffeine, nicotine. Please don't go start smoking. But these are some things that are showing some protection against PD, brain degeneration. So Dr. Paul Adams, picture there, is exploring the role of calcium channels in Parkinson's disease. Now, channels that allow calcium into cells play a key role in the communication process among brain cells, such as the transmission of information about muscle coordination or movement. And doctors have already observed that people taking calcium channel blockers for heart disease seem to be protected against Parkinson's. So Dr. Adams' research is trying to help fine-tune the approach of using these drugs to prevent Parkinson's. And cognitive impairment, and this really needs to be distinguished from depression. Depression suffered by people with Parkinson's. Cognitive impairment includes attention deficit, problems with word finding, slowness in thinking. So what Dr. Khan at Queen's University is doing is she has developed a computer game that will improve cognitive ability for people with Parkinson's. And quality of life research. This is psychosocial research. This is really, research that gives us insight into people that are living with the disease right now. And so Dr. Mike Ravenak at Western University, so what he's doing is developing a framework for information needs after a diagnosis in young onset Parkinson's disease. People diagnosed with young onset Parkinson's disease have unique needs and concerns, but there's very little information out there in education. So what he's doing is actually going to them, by setting up interviews, forums, and that kind of thing, and discussion boards, and talking to them about their experiences in needing and finding relevant information to help them. So with everything he collects, what he plans to do is to develop education materials for people like them and for healthcare professionals. And of course, as I mentioned, clinical fellowships, these are important because they really address the shortage of specialists treating people with Parkinson's and other movement disorders. And our research program, we also have partnerships with other organizations. So there are different kinds of partnerships. Let's say with our regional partners, of course, we collectively fund the research program. And with the Fonds de Recherche de Québec Santé, this is the Quebec provincial funding body. We have a partnership where if a student is going to Quebec, they can apply to both our programs, and then we go, if they both are successful in both programs, we go halves on the award, which means our money can stretch further. We can fund somebody else. And with CIHR, that's the Canadian Health Institutes, what we do with them is they help us with some of the review of the psychosocial program, because they already have the infrastructure in place. Instead of us convening another panel and spending more money for more reviews, they do the reviews for us. So I'll just give you some examples of our how our funds, how we've spent the funds and with the outcomes of some of the funding that we've done in the past. Dr. Pierre Blanchet, he was given a clinical research fellowship in 1993, and he went on to find one of the first people to establish the role of a drug called amantadine, which has always been used in PD, and it's actually a pretty inexpensive drug, but they defined a new role for it as a strategy against dyskinesia. So now it's being used as part of treatment for PD. And just for your information, Dr. Pierre Blanchet is now the chair of our research policy committee. And Dr. Uri Munchi, he was given a new investigator award in 2004-2006, and he's gone on to establish a lab. He's very well recognized. His work led to the identification of why dopamine replacement therapy has an effect on cognition. And so he's very, he actually did a webinar for us a couple years ago. So these are the kind of people that we have funded in the past, and they've really gone on to contribute to PD research landscape. And also Dr. Frederick Calon and Francesca Cicchetti. They were given a pilot project grant in 2007, and it resulted from the first published study that demonstrated the neuroprotective role of the omega-3 fatty acids against Parkinson's. So that's really important. And in 2009, Dr. Ron Postuma, who's actually on our scientific advisory board, was successful in a grant, in one of the psychosocial grants. And he, after his research, he developed a patient and physician guide for describing and treating non-motor symptoms of Parkinson's. And both of these guides are on our website, and they are very, very popular. We're actually going to a second printing of the guide soon. And Dr. Manon Bouchard in 2009 was awarded a clinical movement disorder fellowship, to learn more about how to treat clinical movement disorders. And she went on to open a clinic in Quebec in 2011. And this is our latest one. It just came out. It was a news release after a press release just a couple weeks ago about this. This is brand new. So this is on the right-hand side is I guess the right-hand side is Dr. Kali Gehring, and on the left-hand side is Dr. Edward Fond, who's the chair of Scientific Advisory Board. And Dr. Kali Gehring received a grant in 2011, and Dr. Fond in 2012, and they've collaborated, and they've discovered the three-dimensional structure of the protein Parkin. I'm sure you've all heard of the protein Parkin, which actually protects neurons from dead cell due to the accumulation of defective mitochondria. And what mitochondria provides power to cell function like batteries. So, but when they're defective, they cause cell death. And Parkin is a protein that protects the cells from dying from these bad mitochondria. So, the researchers have always known this, but they didn't know the shape of Parkin. So it's like a mechanic seeing a car but not being able to work inside the car because they don't know the shape of it. So what they've discovered is a three-dimensional structure of this protein, which means that they can go in and actually manipulate the protein. So they can manipulate to maybe find the defective mitochondria faster and stop the disease faster. So they can then try to develop drugs that will do this and catch the mitochondria faster and slow the progression of the disease or catch the disease very, very early on. So this is a really great discovery. And this is a research brochure. It's a summary of an overview of the research program, and you can find it on our website as well if you're interested. It's in both languages. And this is the end of the presentation. So if anyone has any questions, I'm happy to take any questions now.
Okay, so thank you, Julie. I know that we didn't have any questions actually come in throughout the presentation, which I always say means that you must have just done a wonderful job of articulating everything. In an effort to give people an opportunity to enter their questions in the chat if they do have them, well, I've got a few notes that I took, and I think it was a valuable presentation. I hope that everybody attending did learn something. I think that the way that you weaved a discussion of the program itself through some of the different areas that we fund, be they regenerative or restorative treatments, or looking to biomarkers or neuroprotective therapies, just showing that there are different areas that researchers look at in general, and also researchers who are funded by the National Research Program that they're looking at. I found that particularly interesting. Again, I know you mentioned this, but all of the information either on our National Research Program, this brochure that you've referenced, or things like the non-motor guide from Dr. Postuma, things of that nature, those are available both on parkinson.ca or on our regional website, parkinsonCNO.ca. And again, I should mention, I guess, that I think there's always value in highlighting research dollars at work. we work hard as an organization to fundraise to support our four pillars, be they research, support services, education, and advocacy. But research is always a timely discussion for many reasons, and it's very relevant, and it's something that I know we're proud that we do nationally, and particularly as we move into Super Walk season, if you will. It's nice to have that top of mind for me, knowing that we are doing good work with the program, and I hope that people who reviewed the session feel that way as well. Now I see that we do have one or two questions coming in on chat, so I will pause for a moment. I'll say that those of you who would like to sign off are free to do so. Otherwise, we'll stick around and see how the questions and comments go. So thank you for attending. If you do choose to leave, or just hold one moment. Hi, Ricklin. Thank you for your response. For those that aren't seeing the chat, his question is Parkinson's diagnosed based solely on a physician's assessment of empirical observations? And the question doesn't specifically pertain to tonight's content, and we're going to be careful actually with answering it. Generally speaking, obviously diagnosis is a matter best left to a person and their consultation with their doctor. That said, right now Parkinson's is largely a clinical diagnosis, which does mean that the doctor, hopefully a neurologist or a movement disorder specialist, is taking observations of an individual. They're doing some tests to rule out other competing conditions, but they are basing their diagnosis largely on clinical observation. With that said, that is where, and Julie, you can share insight as you have it, but that's where some of the value of those preclinical markers and things of that nature come in. Things like looking for at biopsy that you mentioned is Dr. Lang's work.
Biomarkers.
If we can identify certain biomarkers, some of those certain proteins, things of that nature, they'll help doctors in diagnosis. They'll be a little quicker at diagnosing things, and we can start treatment therefore more efficiently. Is that a fair response?
Yes, it is. Yeah.